Hey everyone, thanks for joining me for the clinical pearl this week. I was wanting to talk about Pembrolizumab for persistent, recurrent, or metastatic cervical cancer, a new journal article that came out. So my name is Nathan Matlock. I am the PGY2 Oncology Pharmacy Resident at Monument Health Cancer Care Institute. So a little bit of background, Pembrolizumab has efficacy in programmed death ligand 1, PDL1, positive metastatic or unresectable cervical cancer that has progressed during chemotherapy. This trial was designed to assess the relative benefit of adding pembrolizumab to chemotherapy with or without bevacizumab. The methods of the trial, the inclusion, female patients greater than or equal to 18 years of age. They had to have persistent, recurrent, or metastatic adenocarcinoma, adenosquamous carcinoma, or squamous cell carcinoma of the cervix. No prior systemic treatment. They were not amenable to curative treatment, and previous radiation therapy was allowed if it's done 2 weeks prior to randomization. Trial design was an international, multi-center, double-blind, placebo-controlled phase 3 trial with an N value of 617 participants. Patients were to receive either pembrolizumab 200 milligram or placebo every 3 weeks for up to 35 cycles, and then paclitaxel 175 milligrams per meter squared, and investor's choice of cisplatin 50 milligrams per meter squared or carboplatin AUC5 every 3 weeks. So our endpoints, primary endpoint was progression-free survival and overall survival. Secondary endpoints were objective response rate and duration of response. Our results, specifically looking at the progression-free survival. In the intention to treat arm, median progression-free survival was 10.4 months with a 95% confidence interval of 9.1 to 12.1 versus 8.2 months with a 95% confidence interval of 6.4 to 8.4. The hazard ratio for progression was 0.65, again with a 95% confidence interval of 0.53 to 0.79 with a p-value of less than 0.001. The PDL1 CPS score greater than or equal to 1 progression-free survival median was 10.4 months, 95% confidence interval of 9.7 to 12.3 versus 8.2 months with a 95% confidence interval of 6.3 to 8.5. Hazard ratio for progression was 0.62 with a 95% confidence interval of 0.50 to 0.77 with a p-value of less than 0.001. Now, if we looked at the subgroup PDL1 CPS score greater than or equal to 10, median progression-free survival was 10.4 months with a 95% confidence interval of 8.9 to 15.1 versus 8.1 months with a 95% confidence interval of 6.2 to 8.8. Hazard ratio for progression was 0.58 with a 95% confidence interval of 0.44 to 0.77 with a p-value of 0.001. So the percentage of patients alive without disease progression at 12 months favored pembrolizumab in all populations. Looking at overall survival now, the intention to treat arm at 24 months in pembrolizumab group was 50.4%, 95% confidence interval of 43.8 to 56.6 versus placebo group, which was 40.4% with a 95% confidence interval of 34 to 46.6. With a hazard ratio for death of 0.67 with a 95% confidence interval of 0.54 to 0.84 with a p-value of less than 0.001. Looking at the subgroup PDL1 expression or CPS score of greater than or equal to 1 at 24 months in pembrolizumab group, 53% with a 95% confidence interval of 46.0 to 59.4 months versus your placebo group of 41.7% with a 95% confidence interval of 34.9 to 48.2 months. Hazard ratio for death was 0.64 with a 95% confidence interval of 0.50 to 0.81 with a p-value of less than 0.001. Now, the PD-L1 CPS score of greater than or equal to 10 at 24 months in the pembrolizumab group was 54.4%, with 50% with a C confidence interval of 45.4 to 62.4 versus your placebo group of 44.6%. 95% confidence interval of 36.3 to 52.5 with a hazard ratio of death at 0.61. 95% confidence interval was 0.44 to 0.84. P-value of 0.001. So the median overall survival was not reached in either the PD-L1 selected population and was 24.4 months in the intention to treat group and 16.3 to 16.5 months in the placebo group. Looking at our overall response rate, intention to treat, again 65.9% versus 50.8%. If you broke and look at the PDL CPS of greater than or equal to 1, it's 68.1 versus 50.2%. And then if you look at PDL CPS greater than or equal to 10, it's 69.6% versus 49.1%. So more complete responses were noted in the pembrolizumab group than in the placebo group, 22.7% versus 13.1%, 21.4 versus 12.9%, and 22.2 versus 11.3% respectively. The duration of response, median duration was 18 versus 10.4 months, 18 versus 10.4 months, and then 21.1 versus 9.4 months respectively. And this was longer in the pembrolizumab group than in the placebo group. So a little bit of discussion. Keynote 826 showed that progression-free survival and overall survival were significantly longer with pembrolizumab than with the placebo among patients with persistent, recurrent, or metastatic cervical cancer who are also receiving platinum-based chemotherapy with or without bevacizumab. This provides an additional modality for patients in the above-mentioned group. So this came out of the New England Journal of Medicine, and here's a screenshot of if anybody would like to look it up and read it. If you do and you have any questions, you can reach me at nmatlock@monument.health, and feel free to reach out. I'll get back to you as quickly as possible. I'll look forward to it, and thank y'all.